Hello, everyone, and welcome to Your Health in Your Hands. I'm Dr. David Ajibade with the Brain and Body Foundation. Now, a few, why does this always happen?
It's okay. Should I
I
do
wanted,
one, two, three?
I was
Okay.
going to say, I was going to say last week, but sometimes they don't do it after each other.
Okay.
I was going to say, okay, thank you.
One, two, three.
Hello, everyone. I'm Dr. David Ajibade with the Brain and Body Foundation, and this is Your Health in Your Hands. Now, previously, I was going to say last week.
It's okay. Again, it's okay. It's not a big deal. That is the beauty of the, you can edit the video every time.
Okay. Hello, everyone. I'm Dr. David Ajibade with the Brain and Body Foundation, and this is Your Health in Your Hands. Now, if you were with us a couple of weeks ago, or maybe even last week, you must have witnessed Dr. Anand's fascinating presentation about stem cells and what the place they hold or the role they play where COVID-19 is concerned. And we particularly focused on the acute phase of COVID-19 when all that damage is happening, when people have to go to the ICU, they can't breathe, they may even be having strokes, and all the attention is being paid on them. That's the acute phase. But we're going to be talking now as to what happens with those who survive the acute phase. And as you all know, many of these conditions linger. People have problems with breathing, problems with weakness and fatigue, even mental. Some people refer to mental fog. They're not able to think properly. They're not able to even remember simple names and simple words. So it is by no means over for many, many, many people. What can be done? We're going to address that. But before I hand over to him, I'm going to remind you about who he is and what he has accomplished. Dr. Anand Srivastava, excuse me. Dr. Anand Srivastava, please forgive me for mispronouncing your name, sir, is the chairman and founder of the Global Institute of Stem Cell Therapy and Research, San Diego, California. He has also held multiple roles, including a member of the National Research Institute in Japan. He is also has several roles in the University of California, San Diego, University of California, Irvine, University of California, Los Angeles, working on bone marrow transplantation, stem cells and neurology, stem cells, and now COVID-19. So, Doc, thank you and welcome back to the show.
Thank you, Dr. Davis, for having me in this wonderful show for Brain and Body Foundation. And so nice meeting with you. And yes, last week it was wonderful talking with you about the COVID-19 and probable remedy using the mesenchymal stem cell. So let's Absolutely. Go for our next step of the talk.
That's right. So let's move on to the next step. And again, it's fascinating that the Food and Drug Administration, which is the equivalent to NAFDAC in Nigeria, has given you full permission to use this therapy in individuals with COVID-19. So that's fantastic. I think we need more of that. So the screen, I've handed over control to you. So take it away.
Thank you very much. And I'm going to continue, maybe, if you allow me to go for our next very important point that I was discussing, that what happens for those patients who came out from the COVID-19. And we heard a lot now, and we have a lot of people telling that now they are out from the COVID infection, but still they are having a lot of problems. Their organs are compromised. They are unable to perform day-to-day work in proper manner. They lost their efficiency. And even sometimes you hear that person is coming out from the COVID-19 and he has all of a sudden that person is having heart attack, and so a lot of problems. So first, why it is happening like that? And second, how we may manage even these kind of patients using stem cells. So the point is, when COVID-19 is infecting you or a person, it going creating a lot of problem, pro-inflammatory cytokines and damaging the lung tissues. And it has a specific kind of life cycle inside the human, where this virus goes and kill the cells during the multiplication. So basically, it enters inside the cell and multiply inside the cell, forms millions of virus inside the cell, and raptures, bursts that cell and comes out and infect other cell. So lot of scar, lot of cell debris, okay, form, and those lung is a highly circulated organ of the body. So this cell debris, which is rupture and damaged cells, are now coming in the circulation, blocking the small vessels, creating a lot of inflammation, sometimes clotting, okay, inside the blood vessels, and that causes the multiple organ. If it is going in kidney, blocking the kidney filtration, going to liver cells, damaging liver cells, and then blocking the heart blood supplies. It can give you heart attack, clogging the arteries and veins, okay. And then if it goes to brain, then there is a brain stroke as well. So how to really manage this? So that's what I was thinking to share. Wonderful slide, and let me share with you.
And just out of curiosity, are these injections or infusions that you give to the patients when you're given this treatment?
Yes. So during that time also, and also during the time of our treatment, and so during the time of treatment, we give stem cell and we neutralize the virus, which I explained in my last week of talk, that how this particular stem cell may manage and neutralize the virus and rescue the patient nicely. But once the patient is out because of a vaccine or maybe some other way, and if the organs are compromised, and most of the time the elderly patient or the patient who has some kind of underlying situation like diabetes, hypercholesterol, and all these things, those patients are also having even much problem. So again, this is very complex look like, but I'm going to explain in very simple manner. So just see, patient is having COVID-19. So this is the COVID-19 coming to the lung, infecting the lung is damaged now, okay, because of this. And patient is now having COVID-19 problem. So this is the lung dysfunction, and because of this rupture and all these things I'm telling, this is coagulopathy, means clotting and all these things, and clots are there, okay, and microvascular dysfunction. So it may affect all the organs. Even the skin has some kind of clotting and rashes, the brain injury, kidney, all these things, okay. So now, how to, and this, of course, this microvascular dysfunction also make a lot of bad cytokines, which I told here, okay. So you can see this, a lot of bad cytokines. And then it can give acute respiratory distress syndrome that causes because of the pneumonia, because there are a lot of inflammation, then water comes in the lung. So a lot of vicious cycle going on, which I do not want to explain in much detail here because of the time, and it is out of scope of for the many people. The point is here that
well, just to recap, the inflammatory cytokines are the things that are created or generated as a result of COVID-19, which damage the cells and organs because of inflammation. They damage the cells and organs, correct?
Yes, you're right. So if you see, here is the virus, inflammation is here. Then these are the immune cells, pro-inflammatory immune cells. It triggers, this is all bad cytokine. Arrow is up means it is creating a lot of bad cytokine, and the cytokine release syndrome and injuring all other organs, including the lung. So when you use this mesenchymal stem cell therapy, which I told that is very good stem cell, which is known for its anti-inflammatory cytokines secretion. This is also known to secrete those cytokines which repairs and triggers the repairing of the damaged organ. So it works at two way. So if you inject this stem cell, it goes and when it is like this flat line here, it means it is blocking all those reactions. Okay. Anti-inflammatory drug also block the same thing, but this mesenchymal stem cell is block inflammation. It blocks ARDS, that is pneumonia and all these things, and all the cytokines. So it goes.
It's more effective than the anti-inflammatory drugs, is that what you're saying?
Yes, because it crosstalk and it releases the spectrum of anti-inflammatory cytokine. As this virus triggers a spectrum of pro-inflammatory cytokine, same way this mesenchymal stem cells releases a spectrum of anti-inflammatory cytokine to neutralize all this. Also secretes the cytokine to repair this damage and the lung damage. So this is very even good for the post-COVID patients who are unable to get their organ efficiency normal, even they are out of the COVID. So that is the beauty of this mesenchymal stem cell. And we have treated few patients in India and our Mexico hospitals using this mesenchymal stem cell post-COVID patient. And we are under the process for post-COVID patient as well for the US FDA.
Okay. All right. So we're going to come back, Doc. But from what I can understand from this diagram, it blocks the acute phase. I think we want to understand, my viewers and myself, want to understand how this therapy puts people back on the road to recovery. Does it cause or stimulate the repair of lung damage? Does it cause or stimulate the repair of liver damage and all those things? So that in other words, does it help the body reverse some of the damage? So we're going to come back and let's address that. Okay. All right. So folks, we will be back shortly. Stay tuned. Is that a fair question, Doc?
Okay, good. So do you want to go?
We're not back yet.
No,
Okay.
I'm just asking a question because now it is stopped. Okay, so I'm just asking a question. Do you want to go again on this? How it?
Are you there? Hello, Doc. The last thing I heard was, "Do you want again?" I didn't hear anything again.
Do you want to go more how it repairs other damaged organs, or we are done here? We can go for the next after the break.
Yeah, like I said, I don't think it came out well enough that it repairs that shows. I don't think you really showed how it repairs damage.
Okay. Okay, good. I will talk.
Okay. We're coming back now. All right, welcome back. I'm here with Dr. Srivastava. We're talking about how mesenchymal stem cell therapy, stem cells, can help the body not only recover, but regenerate and repair damaged tissue. So, Doc.
Thank you again. So I was talking that how it blocks and neutralizes all these cytokines and what are the bad effect of the virus. Even the person is out from the effect of the virus, but the organs are still compromised because of the bad effect of the virus, cytokines and all these things. So the question is here, how this mesenchymal stem cell therapy may repair all those damaged organs or compromised organ of a patient who suffered with COVID-19 but not having the COVID-19 right now. And particularly those patients who has underlying condition like old patient or maybe diabetes or kidney problem or liver problem. So let's see. So when you inject the mesenchymal stem cell to these patients who has compromised organs, so what it does, as I told, it goes and first, so just think like three step. It works in 3 steps, 1, 2, and 3. What is the first step? So when these organs are compromised, is because of the compromised and damaged tissues, is still has the uh, pro-inflammatory cytokine. Because of the damage, the inflammation is still going on there.
Okay.
Not because of the virus now, but because of the damage of that particular organ or cell. And inflammatory cytokines are going there and trying to take out that portion. So acute inflammation is still there. So what does first step, mesenchymal stem cell goes and stop that inflammatory cytokines to further damage this damaged organ, which is already there damaged, okay? So stop the further damage of organ, blocking these cytokines. Then this mesenchymal stem cell also cross-talks with this damaged cells of the organs and secretes those particular kind of molecules which enhance the regeneration of this damaged organ. You see? So first, blocking the bad cytokine. Second, secreting the neutralizing cytokine, which can neutralize this pro-inflammatory cytokine by secreting the anti-inflammatory cytokines. And this third step, it secretes those cytokines which enhance the regeneration of this damaged portion of the organs to bring these organs back to its function, a normal function. And so it works at 3 stages: blocking, neutralizing, and enhancing the repair of the damaged portion of the organ.
I see. Okay.
So this is the way it repairs.
I see. Got it. Thank you. So do you have, again, I know we asked about that for the treatment in the acute phase. Do you have case studies or do you have evidences of people who have used it or you've given this treatment to and have shown significant, maybe not 100%, but significant recovery from the lingering and long-term effects of COVID-19?
Yes, we started treating the patient and we have wonderful results coming out from that. And particularly like after COVID-19, yes, person is out of COVID-19, but lung is still compromised, like a lot of fibrosis in the lung and other things, but few people has like kidney problem and liver problem. And the diabetes people has several other multiple fold of the problems because of that infection. So we see wonderful results after treating them with the mesenchymal stem cell.
Fantastic. Now, do they come to you? Is there like a hospital they go to, or where do they get this treatment?
Just yes. For those who... we have our, as I told, we have our hospitals at different places in the world, and they come to hospital, talk to doctor evaluates everything there at the local hospital and local GeoStar hospital, I will say. And then they get treatment and they are released. And it's so simple, like person is coming, just evaluate their physical condition and then give the stem cells and just go evening to their home. So it's not like hospitalization and staying in the hospital for a longer period of time.
Right. Well, then how about for those who are in the acute phase, like you said, send us a video, the ones who are currently having the active COVID-19, how do you, in that case, they can't walk up to you, can they? I mean, they're probably
yes, they are
critical condition.
You are right. So they are already in the hospital. And once they are in the hospital, they have positive COVID-19 situation. And then we talk with the doctors, treating doctor. And then, as I told, we have US FDA approval on the compassionate basis for emergency use. So we just send the data of the patient immediately to FDA, and US FDA is very quick, I will say. They give us immediately, they return our request, and we can go and use stem cell to treat
That's
those.
fantastic. That's fantastic. So, how are you getting the word out? Because I'm sure there are lots of people at hospitals who would be interested in this as an option. I know there's the standard treatments, which of course include remdesivir and Regeneron, and the other hospital-approved, FDA-approved drugs. How are you getting the word out with regards to this, so people see that there's an option?
So we have been on the television news and newspapers and all the places, and of course I published the papers related to this in academic journals.
Mhm.
And the wonderful people like you who really helps a lot to spread the word and helping the people like your foundation, that I know very well about your foundation particularly, that is wonderful and unconditionally helping a lot of people. So this is the great help we are getting as a GeoStar member from the people like you and other media and social media.
Oh, absolutely. Well, we're all about getting the good word to people about what can help them. And so yeah, that's what we do. But definitely, people need to know about this. So it's we like to help in any little way that we can, for sure. Um, so that's great. I mean, I think we need to have a lot more case studies that we can share with other people, because these are these long-term effects. Sorry, long-term adverse effects are going to be around for a lot of people. I personally know quite a few people who have had this, who are having to deal with these issues, long-term issues. They've long passed the COVID-19 active phase of the COVID-19. They've been treated, they've recovered. The levels of the COVID-19 have dropped to negligible levels, but they're still dealing with the effects of the disease. So it's very important that we can help them. So you said you have hospitals in Mexico, and where else now?
I have in Mexico, in India, yes.
India. Okay. All right.
And we are collaborating a few hospitals in US for COVID-19.
Okay. Are you at liberty to share which hospitals those are? Or that's still under wraps?
No, it is in LA and New Jersey.
LA and New Jersey. Okay.
Yeah.
Okay. All right, we're going to take a quick break now, and then we'll be right back. So stay tuned, folks.
Thanks.
Okay, so I think we have another 7 minutes left. Okay, so well done, Doc. Good stuff. So what else do we want to talk about in this last 7 minutes?
Do you want to talk about stem cell and other like sickle cell disease or something?
You know what? Let's do that. Yes.
7 minutes is more than enough for sickle cell. At least the stem cell part.
Yes. Okay.
That what I am doing in stem cell, what is stem cell, how I thought to come in the field of stem cell science.
Sorry, say that again. What is stem cell?
How I decided I should be working on the stem cell science and how it may help sickle cell.
Okay. We may not have enough time to talk about the whole discovery and how we got there, because 7 minutes goes away just like that.
Okay, then I can talk about how I decided to come in the field and what I did before coming to the COVID, what other things I did. That is, I think, good 7 minutes.
No, we want to talk about sickle cell disease. We don't want to talk about other things. We want to talk about sickle cell disease.
You want to sickle cell?
Yes, I want sickle cell.
Okay, then go ahead, like directly on sickle cell.
Yes, we want to talk about other things. We want to talk about sickle cell and how it's helping those with sickle cell disease. So I know we're applying the same principle, but specifically how we can help those with sickle cell disease.
Okay.
All right.
So,
yes, sir, go ahead.
No, go ahead. Ask the question.
No. I was about to get back into the show, but you were going to say something. I'm
No, no,
not
no.
really.
I'm just saying, please come back in this show and ask the question about sickle cell.
Okay, all right. I'm gonna start now. All right, welcome back, folks. We've been talking about this fascinating discovery of mesenchymal stem cells and how they work with COVID-19. Now, how about the topic that is very near and dear to my heart, which is, of course, sickle cell disease? Doc, how does this discovery work with sickle cell disease?
So this is wonderful story, in fact, and I started the stem cell science with the notion to develop the treatment for the blood-related disease, and mainly two blood-related disease. That is, one is the sickle cell anemia, and another is thalassemia. And as we know, both are very genetic disease. So when we say genetic disease, it means we are very well knowing that this particular kid may have sickle cell disease or thalassemia. And now just come on, sickle cell, and we know that sickle cell is blood-related disease. The globin gene has the mutation. That's what the blood is, or RBC is not in the proper shape. It formed this sickle shape, uh, like this and like this, and clumps, okay? And the kid always has the problem and unable to carry the oxygen and load the oxygen, and so need continuous blood transfusion and all these things. And it's a huge problem, not only for India, but for many other countries like your country as well. And then, so I was developing the gene therapy program for the sickle cell, and the idea was, is it possible to go inside the mother womb and change the gene then and there? So the baby is going to be healthy baby. So starting was not the stem cell science. Starting was the gene therapy, because we were knowing that the gene is the problem.
Right.
So, and depending on the human genome program, we knew now what is the correct sequence of the globin gene. So why not? Because when we know that this baby may have this sickle cell disease, so why not go and change the gene inside the developing baby? Okay. And that's what I did. I showed that, yes, you can change the or insert the gene in developing baby. Even I went and develop a technology where you inject gene to mother. It circulate all the way to mother circulation and goes to the cross the placental barrier and goes in the fetus and may integrate the gene there. So you don't need to do any surgery, nothing. But saying all these things, yes, it is very fascinating. It is very good to talk, but at laboratory condition. When you come in the real life, it is very difficult and complex. And immediately I realized it is complex, though it is very good if you can do, but complex. How to really go for the masses? Because you are not going to treat one or two people. Your aim is to treat millions of the sickle cell disease. So then the idea of the came in my mind that stem cell is the master cell of the body. Our each and every single, what is body? Body is the combination of organ. Blood is also a kind of organ. So when the stem cell is making each and every single organ, it must be making blood also. Okay. So that's the idea came in my mind, and I brought this stem cell at University of California, San Diego Medical School, and started to culturing or cloning these cells in the lab to see if I can make millions of the cells from few cells. So at least I have the cell bank. And then I asked second question, is it possible to differentiate these stem cells into the blood cells? Because our target to make a good blood for the sickle cell disease.
Right. Right.
So again, I will say that I was fortunate enough that I started in 2000, 20-year back story I'm telling you. So in 2000, and I first time reported in 2003, just in 3 years, that it is really possible, and I differentiated this stem cell into the blood kind of cell. And then I published in 2003, 4, 5, and I successfully made the red blood cell, that is the RBC, using the stem cell. And at this time point, we are trying to generate this RBC in the bioreactor to supply for the people who has blood-related problems. So those are the stories. But coming on the particularly on the sickle cell disease.
Mm-hmm.
So if we may use, still the people can do the bone marrow transplant for the sickle cell disease. And the bone marrow transplant is nothing but the hematopoietic stem cell transplant. And this is technical name, but the normal way, if I say layman term, I can say the blood stem cell transplant. So stem cell is specific to the blood. We transplant those, so those stem cell goes, and that is specific for blood. So it makes the new blood.
And you still have to use immune suppressors for that, don't they? For the bone marrow transplant. Okay.
Yes, you need immune suppression, but if you have good matching, exact matching, you don't need for immune suppression. But generally, yes, you use, but the stem cell, which is we are making from the stem cell, we are making O negative. Okay, so you don't need to really match it or immune suppress it. So there is one way. This is one way. Okay.
We have only 1 minute left.
Okay, just in one quick 30 second, I will take. So there is another way, that if you use the stem cell and insert the globin gene in this, and then transplant this stem cell, so that now it has correct globin gene inside, and it goes and give entire new blood cells. So you can really manage this stem cells, or sorry, the sickle cell. And of course, this is very developing science I'm talking, but few people has been treated, and few reports are coming, very encouraging report. That's what I wanted to tell you.
Okay, and I understand that you're building a center in India for specifically to bring this treatment to sickle cell disease patients in India. Is that correct?
You are right with the Prime Minister of India. Yes, it's a huge stem cell sickle cell hospital.
He's building a sickle cell hospital and is going to use this particular treatment for that.
You're right. You're right.
That's fantastic. Now I know it sounds really technical, and you try to break it down, and I'm sure we'll have to watch this a couple of times to really understand what it's all about. But it is very, very promising, and like we discussed, we need to get this thing out to the masses. It has to be less complicated. It has to be something that can be used in primary care centers as well as the teaching hospitals or the tertiary hospitals. So it's very, very important. We're out of time now. Doc, I just want to say thank you so much again for your time, for sharing your wisdom and your discovery with us. Hopefully, this will benefit a lot of people. We appreciate it.
Thank you very much, Dr. David. It's an honor to be with you today.
Thank you, sir. Have a good day. So, folks, you guys stay safe, stay strong, and remember, stay away from COVID-19. God bless. Bye.
Okay.
Yeah, I just. Okay, but I'm going to say it again. I'm going to say this last part again.
Okay.
All right, folks. Thank you for joining us again. Remember to stay safe, and of course, you can catch previous videos, previous episodes of Your Health in Your Hands on our website, the Brain and Body Foundation, and also on the NTA website. You can also watch these videos live on the NTA. I believe there's a streaming channel now on NTA. I'm sure they will let you. You'll see how to do that at the end of the video. So God bless, and we will see you again next week. Bye.
Okay, wonderful.
Yes.
So again, thank you very much. And if anything for me, please let me know.
Okay, sir.
And I will send you the video link